now we're going to have a conversation with Hoban, Charlie Brown, Justin Dolan, who comes from a family of police officers, and he was a detective until he was in a coma after a traffic accident. He now is part of LEAP. Corey Hunt will moderate the panel, who founded Illegally Healed, a support group promoting education and cannabis use, and shares patient histories who have successfully been treated with the plant.
Charlie Brown, what are you doing to include the medical community in the industry as far as regulation? Are there regulations for medical professionals?
Well, you kind of have a division because, medical, guess what? We went first. And what we tried to do was to give them an opportunity to convert their medical dispensary or center so they could do both. They could have a recreational marijuana door. You could enter through that, or you could go the other way. So that was an attempt to integrate them. Some want to stay separate. They were concerned that if they integrated, then there's always the medical aspect of having names revealed, because this is a medical product. So you're always going to have that issue. And right now there is a move, I think, to, shall we say, 2 for 1. But still there's some that like to just be separate, because medical marijuana is selling well still in Denver because the taxes are lower.
And then either one of you guys can answer this. What policies does Colorado have in place that's working to ensure that children have safe access to medical cannabis?
Well, children can get a recommendation from a doctor. Obviously, as minors, they'd have to have their parents buy in with them. And actually, you'd have to have 2 doctors comment on whether or not they believe this would assist or benefit that child. So there is a lot going on in that respect from a regulatory perspective. But the products are being developed, particularly on the medicinal side, such that the dosages and the metering are very low. So your risk of doing something that would harm or affect a child's mind in a particular condition is more regulatable, if that's a word.
Sure, and most recently, your governor signed an amendment or a bill for children to be able to bring their medicine to school. Can you tell me a little bit about that, either Charlie or...
Charlie, I'll let you comment on that if you have a comment. Yeah, they did do that because they wanted to make it clear that if children go through the right steps in conjunction with their parents and have the doctor sign off, that they should be able to use these products and this medicine while at school and not suffer the repercussions, because as we all know, law enforcement tends to strictly enforce the law. And if the law says you can't possess this, regardless of who you are or what you do, a change needed to be made, and I think that was a good policy step in the right direction.
Yeah, I'd also like to add that in places where we have legalization for marijuana, we see a lower incidence of children in school using and possessing marijuana. There's a lot less, chance of a child being able to buy a illegal substance, whether it's marijuana, cigarettes, or alcohol, when it's sold by a licensed facility versus somebody who's selling it on a street corner.
Sure.
You know what? This came up 2 weeks ago.
Yeah, sure.
I do think that this industry, if you will, needs to educate the educators and also the media, because that was the lead story on Channel 4, which is the NBC affiliate. Marijuana allowed to be used at school. Big headline, news at 5, news at 10. I mean, there's no education there. And in fact, I don't even think they didn't say medical marijuana. They just said marijuana. You remember that? Very recent.
From a law enforcement perspective, how has medical cannabis regulations affected the law enforcement community, either negatively or positively?
I would say all of the effects have been positive. There's been a better relationship between the community and law enforcement. Whereas people that were smoking marijuana before viewed the police as somebody who's out to get them, now they view the police as somebody who's there for more important crimes. They're there for robberies, rapes, murders, and they help with the regulation of marijuana. They don't go after users, and especially medical patients. It's a much easier system for the police and for the population.
As a law enforcement officer yourself, what was it what was the turning point for you to understand this is a medicine and these patients are not criminals?
As for me, as a turning point, I don't think I was ever really against marijuana. Even before I was a police officer, there were much bigger issues for me in law enforcement to be taken. And I worked in just about every area except for narcotics. It was one of the few areas I didn't work in. And my father was he was a drug agent. He took tons and tons of cocaine off ships and from smugglers on a regular basis. And we don't catch the people that are in charge. We don't catch the big bosses. We catch mules, peons, people that don't have any other choice but to deliver the drugs or face consequences.
And sorry. Has legalization been as vexing as people thought? Because everybody said that the sky's going to fall in Colorado, and you guys, even the governor was against the bill before he did sign it. And what do you guys see in there? Is it positive or?
Well, I'm on the Visit Denver board, which is the convention bureau, and we've been very leery as a board. I think we're going to let it go on a few more years before they take a position. I like it when I see the businesses joining the Chamber of Commerce, for example. I think that's very positive because it is a business. But let me, in all candor, relay an unintended consequence that we are seeing, because there are always unintended consequences. In the city and county of Denver, we have a lot of homeless people. We're spending more than $1 million a month on homelessness in our city. What we have seen is a proliferation of young homeless people come to Denver since retail marijuana was passed. It's up 58%. So that's the biggest negative so far I have seen.
What would you say to a politician? What would you say to a law enforcement officer who may be on the fence about cannabis?
Balanced, keep an open mind. Also be sure that the users follow our rules. And that's why I don't like 420. The true business people in the industry don't like to see thousands of young people out in our downtown 7-acre park openly disobeying our law. That's the image that you want to stay away from if you really believe in the long-term business aspects of this new industry.
I think as a law enforcement officer and other law enforcement need to understand that we work for the people. And in Costa Rica, there was a recent survey by the university, and 53% of people now support medical marijuana. And our job is to enforce the laws and enforce the will of the people. And we can keep an open mind and look, are there benefits for prohibition, or are there benefits for legalization of marijuana? And we need to go for the best choice.
As an attorney, are you seeing more, have you ever had a case where a jury voted not guilty for a patient? And there's some cases that are happening in the United States like that. So if you could touch on some of those, the guy in Florida, there was a case as well.
Yeah, no, there's definitely an idea that the jury system does work, and that and I'm not a criminal practitioner, but there's a gentleman here who's a living, breathing example of a court in Colorado that tried to prosecute a medical patient and take away his product, and he was he was ultimately acquitted of the charges, and his marijuana was returned to him by the government. That's the first time, to my knowledge, in the U.S. that something like that had happened. And Jason's here, and he's a good man. And there's other examples like that. What we're seeing, unfortunately, though, this is why medicinal marijuana is so critical, because parents of children who are quote-unquote experimenting with medicinal marijuana. As a parent myself, and for any parents out there, I would do anything for my kid and that's my choice, as long as I'm not harming my child. And there's parents that are getting law enforcement actions against them for trying to use medicinal marijuana in some form or fashion, and it's sad. But we do see that there's a recognition, at least medicinally, in even some of the more conservative states across the country, where juries, court systems, prosecutors are much more friendly and reasonable in the treatment of folks that are using medicinal marijuana, whether they're parents, children, or otherwise. So.
And in Colorado, has this freed up a lot of law enforcement officers to focus on other things than trying to prosecute marijuana users? And are you guys seeing any data on that, like the benefits or?
Of course, we incarcerate more people than anybody in the world in the United States, and a lot of those people are nonviolent drug users. And by not only spending the resources of law enforcement, we're not spending the resources on judges, prosecutors, jailers, wardens, the people who have to feed these. It's a huge relief on the tax burden by allowing the law enforcement officers to focus on other more important crimes, people that are actually hurting someone else.
And then what are the patients' responsibility as far as education? Are there tools that are built into your into the bills that patients must be educated, doctors must be educated, or is there anything like that right now? Or what kind of education is available to these people right now in Colorado?
Not much.
Not much.
It's up to the market
Yeah.
to do that. And the doctor thing, I do think we have an issue, as I described earlier.
And are they doing things in Colorado? Are there programs available?
Yeah, I think what you purchase when you go in and purchase your medical product, that there are some, they hand out some flyers and that kind of stuff. And by the way, I want to back up on the 58%. That's not my statistic. That comes from Urban Peak, which is an organization that specifically works with young, homeless people. That's where that came from. I don't sit up there and throw out numbers. But anyway.
What's been the best, hang on 1 second, let me check my notes.
Let me just follow up on that last question, though. While there's not a lot that goes on, there are groups out there. There's a lot of patient advocacy groups that provide information. And sometimes a quick internet search will find that. So the information doesn't always just come from the commercial stores that have a motivation to sell marijuana and make money. And certainly they have some beneficial or benevolent component to them. But there are patient advocacy organizations that are nonprofits and 501c3s and the like that go out there and provide information. And certainly from a parent's perspective, and just your general consumer's perspective, there are things that you can do to go out there and figure things out. And frankly, you've got so many great people at this conference here involved in a lot of those organizations from around the country that that only is continuing to increase.
I want to talk about opening day.
Sure.
I'm not talking baseball. I'm talking opening day, January 1st, a year ago. And we were worried, number one, that we were not going to have enough, and this is for retail, but it's still an interesting aspect of this whole business. We were worried that we were not going to have enough retail dispensaries open. I went to the mayor. We were slow in responding to saying, did they pass their inspection? Did they get this? Did they get that? Was their camera at a right elevation? I mean, when you work with a bureaucracy, I got to tell you, what I've learned on this job is how the city works and how it doesn't. And oftentimes it doesn't work, especially when we're starting this new industry. So we had 3 stores set to open on January 1st, 2014. And again, we were generating international media attention. I went to the mayor and said, we need to open more stores. Do not have them concentrating only in 1 or 2 city council districts. Spread the grief, if you will. Spread the grief around. Spread it around the city. So we ended up on opening day. Thank goodness Mayor Hancock did listen, and we had, I think, 12 stores open. Doesn't sound like many, but I was up at 5 o'clock on January 1st, 2014, and went out, and guess what? The lines had formed. And they were polite, they were patient, and I went to various spots around the city, various dispensaries, and everybody behaved themselves. I did about 8, maybe 10 media interviews. The mayor's PR people decided no, he would not be available for any media interviews, which I thought was a mistake, but everyone was scared to death. We had no idea what was going to happen. And remember what Bob said, Denver was the first and only city to pass any laws, jumping back down to medical and to recreation. Nobody had ever done it in the whole country, in the whole world. And we knew that the whole world was watching, and we had to do it right. And that's, I think, when it began to turn the corner in terms of a more positive public relations for this industry.
And where is all that tax money going? And do you have any figures off the top of your head on how much tax revenue you have created? Can you explain that?
No, it changes. It's funny. 2 months ago, we were not generating enough. We had not made our numbers. Now we are exceeding them. I mean, it just, so we are collecting millions of dollars at the state as well as the city level. And at the state level, much of that, some of that will go for school construction. If you want anything passed on the ballot in Colorado, always put schools. That will have to get passed. So it's still, I don't think it's settled yet. You know, all this is still new, and we're still learning. This is an evolving industry, right, Bob? Changes, it's amazing.
And are you seeing that children have easier access now to cannabis than before? I mean, are the dangers there for kids or patients like sharing medicine with their kids, finding it? What kind of regulations do you have where they keep the cannabis safe at their home and things like that?
Well, that's a good point, too. That goes to an education program, and I'd love to hear your take on this as well. But, you know, the education effort basically says you got to be responsible. As a parent, you can't, you know, we can have a 6-pack of beer in our refrigerator, and hopefully, until our kids get into that teenage years, that 6-pack's going to be safe. But if I leave marijuana somewhere, you just don't know, and that's frankly not worth the risk, and that's where the education component comes into it. And I think we're there in a grand fashion.
Are there any tools to keep it safe as well, if you want to touch on that?
Yeah, I also think that it's a problem we already have, even with marijuana being illegal. In the United States, I saw a lot of children selling drugs because if you were a child selling drugs, you wouldn't go to prison. The parents have no way of selling drugs because they've got 2 strikes against them and they'll go to prison for life. They need the drugs, so that not only do they share the drug use with their children, they put them on the street selling the drugs. I've actually had parents come into the police station after I arrest their kids, ask them first questions, how much money did you make? They don't have a problem with these children selling or using drugs. A bad parent is a bad parent. You know, we can go to education. A lot of the tax revenue goes towards things like education. And when the market has switched from criminals selling the drugs to businessmen selling drugs, you have a lot less activity with children using those illegal drugs and having access to them. And another thing, I'm also now an organic rancher. So, you know, in Costa Rica, there's a high rate of cancer. And, you know, if you have drugs that are illegal on the black market, there's a lot of money to be made, and there's no regulation. You know, people put tons of pesticides, fungicides, herbicides, chemicals to try and cover up the odor. They'll sell products that are, you know, moldy and dangerous. If the product is regulated, it's safer.
And what kind of policies does Colorado have in place for testing? And can you explain why testing is so important to this industry, analytical testing? both for pesticides and solvents and all that?
Well, the pesticide issue is frankly a fairly new issue. Testing is going to be the key to successful implementation of regulation, state by state, country by country, because you need a quality, consistent product that is not contaminated with heavy metals or other things and pesticides. Let me touch on that for just a moment. We've seen pesticides that are being used in the cultivation process. Because remember, Colorado largely is an indoor cultivation state. We grow in warehouses, we grow in greenhouses to a limited extent, but that's increasing but we don't have the climate like you've got here in this country. We also don't have large wholesale marijuana operations that occur outdoors like you might see in California. So pesticides are a significant issue and it needs to be regulated. When you put a pesticide on a plant, does that get into a product that ultimately can affect consumers? Then that needs to be tested for. Currently, testing is only required on the recreational side of the business, not on the medical side of the business. And in effect, it's not a very robust regulatory structure right now, meaning they're testing it out. They're testing the testing. Does the testing work? Do the machines do what they do? Are these third-party independent testing companies actually coming back with legitimate, real results? And if they are, that's good, because then the government can have some level of comfort that the product that's going into the marketplace is safe for consumers, and then the consumers can have the confidence that the product they're getting is what they say it is. So I think testing's tremendously important.
And I'd like to say, when you're growing marijuana indoors, there's a lot less need for a pesticide. The pests don't walk through the walls like as they would walk through a field. Having it indoors gives you a better quality, crop of marijuana that you're growing. There's less need for the pesticide, and less need for a chemical on there to keep the fungus off, because you can control the temperature or the humidity a lot better than you could in an open field. And I think when we're going forward looking for the ways to implement our laws in Costa Rica, I think having the marijuana grown only indoors would probably be a good step just to keep off the pesticides and the chemicals from the plants and keep it a lot more healthy as a product. And I think even maybe going as far as actually having the certification available to make sure it can be certified as 100% organic, which we have now for our vegetables and our animals. And I think that would really help keep the health better of the patients that are having access to a safe marijuana product.
Change subjects again. Being on the Visit Denver board, the convention center, I think the key concern that we had was the image of Colorado. The Jay Leno jokes, changing our state song to "Smoke Gets in Your Eyes," that kind of stuff. Or ski stoned. In Colorado, skiing is a huge industry, and there have been problems, no doubt. And the ski industry now has a, blanket policy. If you're caught, you're out. And then, Bob, maybe you want to address this in terms of employer-employee relationships and what happens. I don't know if that's on your list, because as we all know, this THC lingers in your body. And I think there have been one or two cases, but that's something else to think about, is if you're caught and you smoked 2 weeks ago or a month ago, and they do a drug test and you're caught, your employer in Colorado can fire you. Right, Bob?
Yeah, and the law actually provides that. So the law in Colorado specifically says, and it was an attractive thing for voters, I presume, and that's one of the reasons that portion was inserted in there. Employers, you do not have to put up with employees who fail a drug test. Now, drug testing is generally something that has to have some sort of connection to the health and safety of that workplace. But employers don't need to put up with that. And there are a couple of cases. There's one at the Colorado Supreme Court right now about an individual who worked for the Dish Network who is a legitimate patient. I mean, this is not just someone that went out and said, I have severe pain and got a card as some people tend to do. This is a person with significant ailments, and marijuana helps this person tremendously. And that case is up right now. Can you ultimately terminate an employee for taking a medicine, even though that medicine, because here's the linchpin to the whole thing, the medicine's federally illegal. right? That's what they keep coming. The federal government says it's illegal, so it's not something you can use. And that's an important thing, but it is an attractive aspect of a policy for employers, because employers that don't understand the issue, maybe we don't know enough about the impacts of marijuana from a scientific perspective, employers don't have to put up with it, for example. I'm not so sure that's the right policy, particularly for medical marijuana patients, but I don't get to make those decisions.
Can you tell me what a caregiver is and how does caregiver programs work in Colorado?
I'll give you the legal structure, and then these guys can comment on it. We have caregivers in Colorado. So when marijuana was legalized in our Constitution, it allowed for caregivers. Caregivers meaning people that care for others to use marijuana. A caregiver, as it's defined, is someone who has significant responsibility for a medical marijuana patient. Caregivers mostly would grow marijuana for that patient, process it, provide them with marijuana products. This is what I talked about a few moments ago when I said I called caregivers to try to get marijuana for my mother. At the time, there were no stores. There were websites where you could call people, and they were legally allowed to produce the marijuana for specific patients. So then you had, in 2010, the state regulation on medical marijuana. The caregiver model existed before that. In fact, I was counsel for the case, first time in the U.S. history where a court told a city, the city of Centennial, Colorado, that you have to let this dispensary stay open as a caregiver because there was no state regulatory structure right at that point in time. So caregivers were the concept, the original medicinal component to helping people. Today, we have a caregiver system, which means I can grow plants, and it means that we can all live together and grow plants, frankly, for different patients and provide marijuana. It's outside of the commercial structure, though. The commercial tax structure is not a caregiver model, and what's important to know is we kind of call the caregiver model is the gray market. Because if there is a black market in Colorado, it's the fact that everyone has a right to grow marijuana as a caregiver or, frankly, with a recreational model as just an individual 21 years or older. So our gray market has twisted substantially, and it's mostly based on caregivers. Any thoughts on caregivers?
You guys, are you considering it here? Are you considering the caregiver model? I got real mixed feelings. On it, Bob?
The legislation doesn't contemplate that at
Okay.
this time. It's more of a commercial-based model, which, and maybe that's a good thing to talk about. From a policy perspective, I think a commercial-based model is the way to go at it from the get-go, because what happened is once it was entered into the Colorado Constitution, it became a constitutional right. And there's been a lot of cases, frankly, that say, does that constitutional right mean I got the right to smoke marijuana if I'm a Colorado citizen? Some people would argue that's the case. It's not necessarily the case. There are certain limitations of that. But to go at it from a purely economic, commercial model, this doesn't make a lot of patient advocates happy. But I do think that that's the best policy from a governmental perspective because it prevents any crossing of paths. It may, in some instances, particularly in rural areas, limit the availability of marijuana to certain patients, which is an unfortunate side effect. But what you're talking about is novel legislation, and governmental agencies, actors, policymakers need to have comfort that they're not, as Charlie said, just letting the cat out of the bag and we'll see what happens. They need to have some controls in place for it to move forward, and I think that the commercial model addresses that, accomplishes that.
I think from a law enforcement perspective, anything we can do to take money out of the cartel's hands, out of the illegal black market's pockets, is a plus for us as a society.
So there's an advantage then to having safe access than having to go on a street corner to...
Without a doubt.
Yeah. What's been the best thing in policy reform that you've seen the United States has done from a law enforcement perspective?
It's just that. Just by having legal marijuana, we have hurt the cartels. We have stopped seeing Mexicans illegally transporting drugs into the United States, and the war on drugs is a very bloody and very violent war. It's not just a matter of somebody has the right to smoke marijuana. These cartels and these drug smugglers, they rule by violence. They kill people on a regular basis. You can look on the internet and find hundreds and hundreds of videos of mass executions of anybody who just opposes the cartels. You know, and the best way to stop these cartels is to take away any incentive they have of making money. If we have access to marijuana legally of a higher quality, then these people have no way to make money from drugs.
What's the pulse inside the government right now? Is the majority of legislators liking what's going on there, or you have an inside knowledge?
Yeah, well, looking at the State House, I think it's being tweaked, right, Bob? Every session, always. This, again, it's evolving. You're going to pass some laws, don't think they're not going to change. If you pass them and then not think you're going to have the voters reaffirmed, if you will, that passage. But this is evolving industry. But what you don't want is cannabis chaos. And that's what we did not see. We did not see that in January 2014. And again, that was, but it took a lot of effort to get there by a variety of people. And I listened to industry representatives, I listened to my colleagues, I listened to my constituents. There are some hardcore folk out there that do not like this plant. They do not like it at all, and they will get in your face, and they will tell you so. And they will run opponents who feel like they do. Again, that's from the government aspect. But you know what? I'm term limited. That means I can't run again.
I would just say that I think that a top-down regulatory model, it can work. And for all the reasons I talked about earlier, it is something that governments should consider. And just not to go on a tangent, but there was a government in the mountain town of Granby that hated marijuana so much. There was an article in the Westward called "The Most Pot-Hating Town in America." They annexed part of the county that was outside of the city limits to stop a marijuana dispensary from opening. I went to that city council meeting, and all of the arguments from the parents, concerned parents, I don't mean to make light of them, but from the parents and from the council members were that, oh, you're bringing marijuana to our town. No, I've got news for you. Marijuana's in your town, and it's a heck of a lot easier to get than if you put a store on the corner that only lets 21-year-olds or older or patients in the door. And that's the message I think that folks need to get. Regulation does work in marijuana.
Yeah, I'd like to add that since we've started the war on drugs, we haven't had any success. We now have cheaper drugs. They're more readily available. We spend trillions of dollars. We have more people in prison. And these people in prison, we can't even keep the drugs out of prison for people that are in prison for drugs. It's a very unsuccessful model, and it's time for something different. We've been doing the same thing over and over and over again, and there's no reason for us to expect any different result. We need to change our model, and we need to regulate marijuana.
And I don't know if you guys are doing this, but one thing I like about Colorado is home rule authority. Home rule authority. So if indeed are there some communities that don't want this in their community, then they have a right to vote it down. In Denver, we decided we wanted it. We went ahead and we passed our own rules of regulation. There's still some parts of Colorado that do not want any part of medical or recreational marijuana, but that's up to them. That's almost a sacred belief in the home rule authority, and boy, if you can incorporate that, I would advocate it. I don't know if my colleagues are going to agree with it up here, but I really let them have that right to turn it down or vote it up, you know, on a one-on-one basis. So you approve it across the country, and then you let the local communities determine if they want dispensaries in their little town or communities.
I have no further questions. If anyone wants to add anything else, that's...
You want to address that, Bob?
No,
I like to hear your...
No, I think, first of all, that's sort of a fundamental American political concept, the idea of local control. At the federal level, you've got states' rights. States are going to preserve their right to do certain things. Home rule in the western United States especially is sort of an extension of that. So states can say, you can do this and you can't do that, but local governments have the ability to opt out. I can't say it's a bad policy. I don't believe that you should force a local jurisdiction to have something that they don't want. And you know what? If you are in the minority in a democratic process in your town that does not want a dispensary or a medical marijuana system, political change it's not easy. But what we're doing here, there's a groundswell. You can effectuate political change in a democratic process, and that's what it's there for. So, Charlie, I would agree with you on that.
Good. And one last point. In the city and county of Denver, we ban pit bulls. That's right. Very controversial issue. Pit bulls, in my judgment, are a rural dog. They do not belong in the city, and they have attacked young people and killed them. And so the city council, before I even got there, banned pit bulls. And it's worked out. You don't see headlines anymore with children getting killed by that animal. Highly, highly controversial. But other cities around us have done it. Again, that's that local control aspect.
Sí, sí, sí. Oh.
Why have doctor organizations since 1937 been ignored on this? Again, what's the speculation? I mean, what you guys have been saying makes perfect good sense. What took us so long?
I don't, change is slow. I don't want to talk about U.S. Supreme Court cases. I'll put everybody to sleep, especially before lunch. But that is a conversation you and I can have at another time. I would suggest to you politically, the son of the great Jack Herrer is here. He's written a book, and that book really does a great, Jack did, great rundown of why marijuana prohibition came to fruition. That's a rhyme, huh? Marijuana prohibition and why it was politically charged. It was racially charged. It was reefer madness at its finest, and that book details that very well. So I'd direct you to that. But thank you for the question.
Bueno, damos por concluido esta mesa de conversación.
Sí, tengo una pregunta, disculpe. Me ponen el micrófono. Since it's still such a controversial topic at the moment in the country, and there's a bill currently being reviewed, I think the bill itself seems to be very enclosed to the pharmaceutical side to it. Since you've seen both the medicinal side and the recreational side, they seem to be enclosing it in a pharmaceutical area to try and make it airtight so that there's no recreational availability in future situations. Do you agree with this, or should this only be medicinal, or should it be open to recreational use in the future?
I'll start on that one. My thought is that, remember, pharmaceutical companies typically create a synthetic chemical mimic of a natural product. I don't think, well, I'm not a scientist. You're about to hear from the great doctor. But at the end of the day, a synthetic product, I don't believe, can mimic the actual effects and the interaction with all the compounds in the whole plant, number one. Number two, because of that, I think there's always going to be a market for marijuana-based natural products, whether that's as a dietary supplement or as a recreational product or simply as a boutique organic product. I think that they can always exist side by side. Big pharmacy, that's certainly a discussion in the U.S. as well. It's a concern of a lot of people. But we've got a robust industry now on a limited basis, state by state in the U.S. Even if pharmaceutical companies come in and take a large share of that, I don't think that impacts the ability of a pretty robust industry to grow up around the actual plant.
From a law enforcement standpoint, by having even recreational marijuana legal, we put a big impact on the amount of money that goes to criminals, and that we're here to stop that money from going in their pockets. And when that criminal organization is running the black market, they'll sell it to children. They don't care about quality or purity. They only care about money. And I think we should legalize it for anyone who wants it. It's something that's for everybody. It's not something that we should. we should restrict it. If there's no harm involved, we shouldn't pass a law that's going to make it more harmful, more dangerous for our public.
Well, as an elected official, I have to listen to, number one, my constituents, and I think they appreciated the fact that in the state of Colorado and the city and county of Denver, we started with medical first. And then we saw the problems, the inherent problems that we had to correct, and we're still doing, and now we have both. But I do think that they appreciated the fact that we didn't come in with both medical and recreational. We would have been overwhelmed. So I like our approach.
Thank you very much.